54% more likely to commit suicide as law enforcement than the average person in the public.
I wonder if you just distract yourself from actually dealing with how you feel and you just keep working so you could avoid even addressing it.
But there's a very high rate of divorce within law enforcement. We become addicted to work and not caring for ourselves, not caring for our families. It's dangerous.
What kind of situations are you seeing most frequently now?
Actual first responders, troopers, they go to a lot of domestics. So there's a lot of physical and verbal altercations.
Have you noticed any patterns, particularly with individuals that are dealing with mental health issues?
Is really just, unfortunately, it's a distrust in law enforcement. Really not trusting that we or anyone is there to help them.
Do you think the officers are equipped to handle these situations?
This episode of Candid Minds with Dr. T and Friends is brought to you by Mindful Care.
Welcome back to another episode of Candid Minds with Dr. T. I'm addiction psychiatrist, Dr. Tamir Aldad. I am here today with my good friend, Kurt Labuda. Kurt is the president of the New York State Police Investigators Association, former Army veteran, a leader in his space, and a strong advocate for mental health. Kurt, thank you for joining me today.
Thank you for having me.
So for our listeners, share with us a little bit about your background and particularly your strong commitment to mental health.
Yeah, so I've been with the state police now going on 20 years. I've spent many years doing different things. I was a road trooper for 8 years. I was a backroom investigator for 8 years, and I was a senior investigator overseeing a backroom, a supervisory role for 3.5 years. I've been the president of NYSPIA, the New York State Police Investigators Association, for about the last 10 months now. So prior to my law enforcement career, I was active duty in the Army. I served in Iraq in 2003, and I also did several other jobs too before becoming a trooper. I like to say I lived a life or two prior to becoming a trooper. So
Wow.
I was in the highway department for 2 years, so local highway department, worked in some quarries, worked in some warehouses, and currently married with 3 kids.
Nice. So in a previous episode where you joined me, we talked about mental health within law enforcement, particularly focusing on officers and their mental health and their access to care. And it was a great conversation, and I appreciate your insight. Today and on this episode, I want to focus more on what you've seen and what your officers have seen in regards to mental health in the community. It's almost like the flip side of our previous conversation. Curious to start, have you seen any change in how you and your officers perceive mental health in the community over the last couple of years?
I think we've become much more aware. There was always a system in place where we would identify people going through a mental health crisis. There was a system criteria called 941, where if someone posed a risk to themselves or someone else, we could involuntarily bring them to seek some type of medical help, psychological help. Over time, right, there's been a lot more studies. There's been a lot more attention drawn to incidences, with mental health situations within law enforcement. So we've really have been trying to educate and train our members, to identify some people maybe in a high stress level that to diffuse the situation, right? Try to talk them down. There's different different units within the state police, and different trainings which we take, in which we can talk to people and try to de-escalate a situation.
What kind of situations are you seeing most frequently now?
So most frequently, actual first responders, troopers, they go to a lot of domestics. So there's a lot of physical and verbal altercations, really emotional situations where people have, where they have breakdowns, or they have some type of like psychotic episode due to potentially a divorce, issues financially. And we respond a lot to those, We'll even some assault, situations where people will have breakdowns and, a lot of mental health issues. Unfortunately, we see it with kids, who are victims of sexual assault or molestation, where then they'll cause mental issues, and those kids will act up and, misbehave, and will respond or have to interview them and have to trying to, try to maneuver our way through through an interview or through a situation, while trying to deal with their mental health.
Do you think the officers are equipped to handle these situations?
I think we are. I think there's a lot, especially with the state police. We really pride ourselves on our training and our professionalism. It's not to knock at any other law enforcement agency. I think that everyone is responsible for their training and their departments. I believe the state police does a really good job in our professionalism and training. And really taking note of things that are going on within society and within law enforcement.
Where are the gaps?
We could always work on more training, right? There's gaps also with membership, right? We're really hurting in numbers. Mm-hmm. So some of the gaps are just making sure that we have retention. Retention is a gap. Having members stay on in some of these positions that have the training and have the experience. That they can not only help with these situations, but also the peer-to-peer training, right? Working with younger officers and investigators. And always, right, it's budget. Having the money to train and having the money to afford, resources to work with us, with the police to help people in a time of crisis.
And we always treat individuals through the lens of building coping skills for them to navigate their own crises as best as they can and learn how to navigate stress. Do you feel there's sufficient training among officers to have the right coping skills to deal with their exposure to these types of situations?
No, I feel in law enforcement, this is the reason why I'm here today, is to bring awareness. I think we failed in that. You see that in the suicide rates, what we spoke about previously. We're 54% more likely to commit suicide as law enforcement than the average person in the public. They don't train you, or they haven't trained you. When I came on 20 years, we're not trained in what we're going to see in the kind of the systematic trauma and critical incidences that we deal with. We previously have not been trained to deal with and cope with that. So then we rely on ourselves, our own coping mechanisms. And a lot of time that is suppressing our feelings and just keeping those in check so we could get to the next case or the next incident, which is not healthy. And at times that's when you see law enforcement kind of maybe explode or react in a way that is
ultimately burn out.
Burnout is huge, and I see that all too often. There's a phrase that would bother me to the core. And, I had many friends and many peers over the years that would say, I don't care. And that not caring has to do with burnout, right? There's a lot of different things that factor into that. But ultimately, I think it's just the mental aspect, right? The mental strain, the stress, the sense that you're not, you're not supported, that you just stop caring. And I always believe when you stop caring, there's no reason in doing it. And a lot of times I would get, well, why do you care? Why do you care so much? I really believe that, someone has to care. You have to really want to do what you're doing. You have to really want to make a change. So if nobody cared, then what's the point, right? When we just throw our hands up and give up. So, but when you see that burnout is really when you get.
With us, we care too much. I mean, I'm just thinking about it as a physician. I went into medicine because I care, and then almost felt like I had compassion fatigue, where I was caring and eventually neglected almost myself in the name of caring for others. You got to be careful, right? When you're talking about caring, that you're putting yourself first also, right? And then that's translates in anyone who's he's kind of in the duty of being in service to people, right?
Not only yourself, but your family, right? There's a very, I don't have the statistics in front of me, but there's a very high rate of divorce within law enforcement. And that has to do to that kind of being obsessed, right? That work ethic where you're just going to go to work and then you burn yourself out. And by the time you're working so much, you're not communicating, you're suppressing your feelings, different things.
It trickles down the rest, and everyone in your life, your parents, your kids, your partner.
Yes. And we become addicted to work. and not caring for ourselves, not caring for our families. And it's dangerous.
I wonder if you just distract yourself from actually dealing with how you feel. Like if you're walking into these high stress situations, a lot of them require you to be in the best mental health. You're helping others navigate mental health issues. You don't really even have time to stop and reflect and navigate it yourself and process what you're seeing. And you just keep working so you could avoid even addressing it.
Yeah, I think there's a lot of truth to that. But the key is really, and I think that we're trying to do that now. We're doing a much better job in identifying that, right? Having supervisors or having people in place where they can identify and say, hey, Kurt, I noticed you've been a little off. I noticed, you kind of been a little recluse. Is everything okay? Of course, my initial answer would be like, yeah, everything's fine. Don't worry. But as they observe and as time goes on, things aren't changing, and trying to, get the help, trying to, hey, listen, let me talk to you. I really noticed this, and just really taking the time to care, but also having people in a position that are qualified to identify individuals who are burnt out, who are, going through issues. All too many times, one of my jobs is to deal with personnel complaints. And when I say deal with them, I kind of oversee them. I almost a liaison between the adjudication within the state police and the member, making sure they get proper representation and due process. But these situations add an immense amount of stress and mental anguish to some of these police officers. Though they might have made a mistake or done something wrong, ultimately most of them are still good people, right? And now they have this hanging over their heads. And we really try to take that into consideration and make sure that we're monitoring their mental health, and making sure that what we would perceive as don't overreact or don't do anything that they'll regret, and try to keep things into perspective with them as they're going through these difficulties.
So as they're exposed to different situations, right, and it's a pretty diverse job in terms of what law enforcement has to navigate on any given day. You don't really know what you're going to walk into. We're seeing a rise in mental health awareness. People being more cognizant of their mental health, more mental health situations. Does that really mean that there's a rise in actual mental health crises, or there's just more awareness, therefore it's more visible? Put that aside for a second. Do you ever feel that law enforcement officers have a sense that this isn't what they signed up for, navigating mental health issues?
I think that's a fair statement. I think that a lot of people out there say that that's not, I wasn't here to be a counselor, right? I wasn't hired to be a counselor. I can't give you an exact situation or conversation, but it's definitely, I think, a feeling that's out there. We came on the job. Everyone came on. I call it the job. Law enforcement to do something specific, right? We all had a purpose. Many years ago, law enforcement didn't pay so well, so a lot of people did it because they really had that that purpose to help, to protect and serve. A passion. Nowadays law enforcement gets paid a little better. So some people now are taking the job because they want to be financially stable. But it doesn't take away from the purpose, right? No matter what you do it for, when you go through your training and you actually put the uniform on, or in my case, you put the suit on, because investigators in the state police wear suits for the most part, unless we're in a different unit. But when you put on your uniform, whatever your uniform of the day is, you have a job to do, right? Irregardless of what your original intentions are, and many times. You're right. It wasn't to counsel, right? It wasn't to be a mental health practitioner or kind of a liaison, and it becomes overbearing, and you'd say too much, but it becomes a lot. And awareness.
So do we change the job, or do we change the person that responds to those situations?
I think we spoke about this. I don't think we change. I think we train them better, right? A little more awareness to what you're going to have to deal with, right? And we do a good job on that. We really do a good job on preparing our officers for all different types of situations. So, as we talk, just a little more transparency on, hey, this is great, right? There's all these units out there. You could see the Become a Trooper, which the state police has spent a lot of time in trying to promote, the state police and show these great units and how fun it is. But there's also a dark side to it, right? There's a lot of things that you'll have to do or see or witness that aren't glamorous, right? That you're not going to want to talk to your spouses. You're not going to want to talk to your friends about, just because they're hard to deal with. Not because you're doing anything wrong,
Right.
But those are the things that I think we need to be honest and upfront, and the training really needs to emphasize that, not just with the state police, but through all law enforcement, that these are situations you're going to have to deal with. I could specifically remember 20 years ago going through training, and there was a whole section where that's what we dealt with. We dealt with live kind of role playing where we were the troopers were depicting themselves as being, having mental health issues, and us as new, recruits or in the academy were, how do you react to that? So we always have kind of trained for that, but I think we could always get better and maybe more training.
I think that's reasonable. So a lot of times before individuals make it to me, you and your team, you guys are the first responders, right? You're there first. Have you noticed any patterns, particularly with individuals that are dealing with mental health issues, that would be helpful for me and my team to know, being that you see them first before they even make it to us?
I mean, the biggest pattern I've noticed and heard of is really just, unfortunately, is a distrust in law enforcement. When we're dealing with individuals who are going through mental health issues, is just, one, there's a distrust for everybody, right? More authority, I guess, but really not trusting that we or anyone is there to help them is what I've seen the most, through my experiences, is having people, again, these are individuals that we're called upon to help, or situations we arrive at where the individual thinks that we're just there to hurt them or punish them, when in fact, many times we're there to try to help them. So I don't know how to change that, especially when someone's going through a mental health issue, when they're irrational to begin with. But that's probably the biggest hurdle to overcome, is just building that trust with the individual that we're here to help.
And anything in terms of how they present? Are there patterns where you wish that we educated patients or individuals differently, in addition to trust, right? Which is certainly something I could take back and reflect on and make sure that people realize the entire healthcare system that you and your team and EMS, and it involves a lot of people, right? Mobile crisis units are all part of the system. It's not just your therapist or your prescriber. We could work on that. How about in the way people present? Is it different from the way I see them presenting by the time they make it to my emergency room or to my office?
I mean, I could say that, like, if physically presenting yourself to us, you really don't want to put yourself in a situation where you have a weapon or something that could be perceived as a weapon in your hand, right? Especially if you're at a time of crisis. So, if there's something you say, hey, listen, if you're going through an incident and the police are coming, just make sure your hands are free. Just make sure the police can see your hands. Really, that kind of puts everyone at ease. If you're pacing with a knife in your hand, or there's a report that, hey, there's weapons in the house, and you have your hands in a bag or a pocket, how do we know you don't have a weapon? So I don't know how you would get that across to someone, kind of.
And it depends where they are in their crisis.
Correct.
Right? If they can even think through creating a safe environment for you and for themselves.
But repetition is good sometimes, right?
Yeah.
And someone's in crisis, if you hey, listen, just know that if there is another time, if there is a need, that just try to create a safer environment, so that they can help you without hurting themselves, right? Not take away not hurting you, but hurting themselves.
Right.
And I think when we say that to people who are in we're not, hey, we don't want to hurt you. Sometimes that escalates the situation. Like, hey, we don't want ourselves to get hurt.
Yeah.
And then we're responsible. Well, I'm not going to hurt you. Okay,
And
good.
And you come from a place of partnership.
Yep.
Yeah.
And that's some of the training that we go through. And I think those are things that can get across, like trying to create a safer environment. So when the people who arrive, and you can say people, right? It doesn't have to be law enforcement. It could be mobile mental health, EMS, just have a safer environment. So
Have you thought a little bit about how if you could build the ideal system of how to respond to a situation where there is a mental health component, what would that system look like to respond as best as possible between law enforcement and clinicians and EMS? And what do you think is the wisest way to handle those types of cases?
I think it would be similar to EMS, where they stage, right? We have to secure the scene. We have to make sure the scene is safe before anybody who's not a police officer. One of the things we try to do is we try to remove people not involved in the situation from the scene too. So if there's family members there, we don't want anyone else to get hurt. We put ourselves in danger, but having someone who's trained or has the ability to potentially, as we call them with ourselves, we're crisis negotiators. Different. We're not psychologists. We're not counselors. But if we do have people who are trained, if we do have clinicians that are on scene, similar to like an ambulance that would be staged. Hey, once the scene is secure, we can bring you in and you can start maybe treating them, talking to them, trying to build a rapport that you can carry over.
So maybe it's like a three-pronged type of approach where there is law enforcement, medical EMS, and like mental health EMS showing up.
Correct. Instead of having a mobile medic, mental health EMS, maybe that's something that needs to happen where they expand or put a counselor, a mental health person in an ambulance. I mean, unfortunately, we see, with EMTs and ambulances, they're becoming harder and harder to get volunteers and trained individuals. So adding another specialty to the bus might not be feasible. But I think it goes back to what we said earlier is funding, right? Funding is big. So being able to have the resources and who pays for that, who's trained and who's going to pay for the training is a big thing. But I think it's important, if there's really a way to make an impact, and if that's what I'll say society, right? Politicians, legislators, that's what they really want. That might be a very good thing to look into, is adding a mental health individual to an ambulance, to a bus where they can arrive on scene.
Ideally, one that could administer medication as well. I think adding just a therapist that talks a situation, that's limited in a sense. But if you have one that could also navigate through therapy and talking, but can also administer medication and at a time of crisis, that could be a very interesting function where they know how to basically handle an emergency, a mental health emergency, through de-escalating, but also med management.
See, the issue, though, I perceive with that, and again, maybe it's something that could be bridged, is before you can introduce a therapist to a scene, the scene has to be secure. Once a scene is secure, and typically the scene is secure when that individual is in custody, restrained or somehow in custody. At that point, we can bring them to where they need to be. So the question would be, and I don't know the answer to this, is it better to get to start that therapy, those conversations immediately, or is it good for them to settle down and start it in 20, 30 minutes when they get to the hospital or they get to another facility, right? Because I don't think you're going to bring, this is the danger of, if you're allowing someone to pace and we're trying to de-escalate and we say, okay, doctor, all yours.
Yeah.
That situation could turn bad really fast. And that's what we're trained to do, is to secure those situations and not allow it to turn bad. And I would hate to see, there's obviously videos, examples of situations that went bad that maybe could have been handled or should have been handled differently. So I hate to have that knee-jerk reaction where just because one or two things went bad, that now we're looking to change the entire system. I think over time we've done a good job. But there is, obviously, as I said earlier, there's things I think we could do better, and there's better training and maybe some more innovative ideas on how to implement some type of therapist, doctor, someone
I was thinking more through the lens that we have both physical restraints and chemical restraints in the hospital, depending on a situation. And you're always supposed to use the least amount of restraint for a situation, right? You don't want to skip any step and do something that's over the top and unnecessary, even if it's easier logistically. Introducing chemical restraints to these situations could be interesting, because it would limit the physical restraint you would have to use to, what you're saying, mark it as a protective environment or a safe environment. Particularly, you're doing that using physical restraints, assuming. Yeah.
Typically. Yeah, we have a with that being said, the state police has a use of force spectrum where we're trained in different things on the situation which it presents ourselves on. One, like I said, de-escalation, but as the situation arises, right? If it's just someone being verbally abusive, on what we should do, and as it rises, there's different tools we have. We're taught, kind of hand to hand. So, we're trained in being able to kind of handle ourselves and take someone into custody. But then, we have tasers, we have pepper spray, and we also have batons. So, and then ultimately, yes, we have our guns, which is absolutely the last resort.
So I'm thinking before all of that, if there was like a mental health paramedic that might be helpful. I don't know. I'm just brainstorming now, but there could be something where we add a mental health paramedic type role to support even early on in a situation to make it safe before it escalates to any of these other tools that you have to use. Food for thought. I don't think we have
absolutely. You could definitely be able to assess the person's actions and demeanor probably a lot better than we could, and maybe diagnose them through some mannerisms or things, saying, hey, this person, I think we're going to have to take them into custody and we'll inject them, or hey, just give them another few minutes. They should calm down.
Help triage the situation in a sense.
Possible.
Could be interesting.
Yep.
You've had a lot of really great ideas on our previous episode, on this episode. I'm curious if you had to pick one that you would want to put into effect tomorrow that would have the greatest impact, right? We talked about education. We talked about changing how we approach crises. We talked about officers being more comfortable coming forward. We talked about educating the public of being more of a partner when it comes to how they approach law enforcement. All really great ideas, and eventually I hope you can achieve all of them. But if you had to pick one that you think would have the most meaningful impact, what is top of mind for you?
I think it's what we talked about is really having that mental health wellness, right? Awareness. I think that would be the most impactful, immediate impact is allowing the ability to help, an outlet for law enforcement to be able to express themselves and get some help. That's on that's an internal thing that I think. You're talking big picture and perception, and I actually think just having more outreach, having more dialogue and transparency on actually what we do and what our intentions are, I think also would have a big impact on the perception and trust, and or building on the lack of trust with law enforcement.
Absolutely. No, I agree. And I think that's a great place to start. There is a lot of work to be done. I salute you for being an advocate for mental health, coming on our show, working with us even outside the show to make sure there's access to care and educating and spreading awareness. So you're certainly doing good work. And I wish you all the best moving forward. Look forward to working with you further, and truly believe that you're a beacon of hope for your team, which is great.
I appreciate that. If I could just add one more thing.
Go for it.
Again, when we talk about the human aspect to law enforcement, how people perceive us, what the human result is, what impact does it have on us, on being fathers and mothers and parents, and the average law enforcement life expectancy is 57 years old. The average person is 78 to 79 years old. So there's approximately a 21-year difference in life expectancy. And a lot of this has to do with stress, has to do with lifestyle, right? Shift work. It's not to underscore or diminish any other profession, because every person, that's one thing that I really try to stay away from, is comparing, right? That my stress is more than your stress. We all deal with it differently. We all have our own aspects. But I think there's some truth, some realities that we just can't ignore, right? 54% more likely to commit suicide. Life expectancy up to 21 years lower than most professions. And I'm sure there's an outlier, right? You could probably find a profession. What do they say? The most dangerous job in the world. I think is like being a crab or a lobster, on those shows.
No, I thought it was a tugboat operator.
Tugboat operator. See, but they're always, so not to say that it's, the only. There's others out there, and again, they have my respect and appreciation for what they do, and again, that's something that I don't think we should take lightly. But talking about law enforcement and what we sign up to do and what the men and women are out there doing, I think it's not it's a very honorable job. And I think we need to respect it as such. We hold ourselves in a high standard. We should be held to a high standard, but we should also be acknowledged that we're humans and we're not perfect.
Absolutely. And I thank you for your service. I thank your team for their hard work and service. I also thank you for being here today and being on the show. So
thank you.
Appreciate that.
I appreciate it.
And to our listeners, thank you for joining us. We look forward to seeing you on our next episode.